my name is Amber Goana and I would like to welcome you to my Med Talk. This is going to be some of the things I pulled from the CPJE California law exam, and as you can see, it's going to be basically like a little Naplex, and so each video is just going to go over each section that I kind of pulled little things from, and I hope you like it. So for this section, we're going to be going over medications that have an FDA-approved indication in the use of constipation and or diarrhea. First up, we have osmotics. These work by drawing water into the intestine, which is going to increase the interluminal pressure, causing the colon to distend and increase peristalsis. The onset of action varies. It could be 1 hour to 4 days if taken by mouth, but if given rectally, it could be as quick as 15 to 30 minutes. You have polyethylene glycol. Muralax is another name for it. It's 17 grams dissolved in 4 to 8 ounces of fluid with a max of 17 grams a day. You want to avoid use in patients with a GI obstruction. We have a magnesium hydroxide. Milk of magnesium is another name for it. It's 2.4 to 4.8 grams at bedtime. It could also be spread throughout the day, but usually it's recommended to take it at bedtime. You want to avoid in patients with renal impairment because it can accumulate. Because it has that magnesium in it, you don't want it to accumulate in those patients. There's glycerin. Pedialax is another name for it. It only comes as a suppository formulation, and it is to be inserted into the rectum. There's lactulose. Constulose is another name. It's 10 to 20 grams daily, and you want to avoid use in low galactulose diet requirements, most commonly used for hepatic encephalopathy. There's sorbitol. It's 120 milliliters that's inserted by a rectal enema once a day. It could also be taken 2 to 3 tablespoonfuls by mouth. When taking into consideration these osmotics, if you're wanting the patient to defecate quickly, your go-to option is going to be a glycerin suppository. General side effects for all of these are going to include bloating, flatulence, hypernatremia, and also hypokalemia. Next, we have bulk forming agents, which is going to help retain fluid and increase in fecal mass, causing a stimulation of peristalsis. The onset of action also ranges, but it's actually a little bit longer, 12 hours to 3 days. We have selenium. Metamucil is another name for it. It's 3.4 grams that's dissolved in 8 ounces of liquid up to 3 times a day. Then we have methylcellulose. Citral's another name for it. It's 2 to 6 grams a day. We have calcium polycarbophil. Fibercon's another name for it. It's 1.25 grams once or 4 times a day with a max of 6 grams a day. The last option here, we have wheat dextrin. Benefiber. It's 4 grams in 4 to 8 ounces of liquid 3 times a day. Some general precautions with all these bulk forming agents. It is actually the treatment of choice in pregnancy. You want to avoid use in patients with GI obstruction, and they need to be taken 2 hours before or after other medications because they don't really absorb very well, and they're also going to cause medications that they are taken with to also not be absorbed very well. Some side effects include flatulence, bloating, obstruction of esophagus, so be sure to take with adequate fluids. Next, we have stimulants. They're going to stimulate colonic motility by irritating luminal nerve endings, causing reduction of colonic water reabsorption. The onset of action is going to be 6 to 12 hours if given by mouth, but if it's inserted rectally, it can do as quickly as 15 to 60 minutes. Synecot is another name. It's 17.2 to 34.4 milligrams up to twice a day with a max of 68 milligrams a day. We have Sina Plus, which is going to consist of Sina and Docusate. And then we have Bisacodyl Docalax. It's 5 to 15 milligrams by mouth daily or 10 milligrams rectally daily. Do not take within 1 hour of antacids or milk or dairy products. General precautions with all these stimulants. You can store the suppository in the fridge or run it under cold water if it's a little soft, and it'll help harden it up just a little bit so you can insert it easier. Before you remove from the wrapper, obviously, because you don't want to unwrap it and then, put some water on it or insert it into the refrigerator. It's just going to cause some malformation of the suppository. You want to avoid use in patients with pre-existing stomach pain, nausea, vomiting, or changes in bowel habits within the last 2 weeks. So if they've been having problems for about 2 weeks now, you don't really want to be throwing stimulants at these patients. Some side effects are abdominal discomfort, electrolyte abnormalities. Next we have emulsants, stool softeners. These are going to increase water absorption into the stool, which is going to allow it to be passed easier. The onset of action ranges from 12 hours to 3 days if taken by mouth, but if it's inserted rectally, the onset of action is less than 15 minutes. There's Docusate, Colace is another name for it. It's 50 to 300 milligrams daily with a max of 500 milligrams a day. Then we have Cinna Plus. It's the Docusate and Cinna, so it's a mixture of this stool softener as well as a stimulant. General precautions with these stool softeners. They are actually good to use in patients with dry or hard stools, or like if their iron is like kind of inducing that constipation. The max amount of time you want to be using stool softeners though is 7 days. So after 7 days, you don't really want to be taking these medications really long term. Or if you're taking mineral oil, because actually taking a stool softener is going to increase the absorption of that mineral oil. Or if the patient is experiencing abdominal pain, nausea, or vomiting. This next medication here doesn't really fit in a category, but it's lubiprostone. MTZ is another name for it. It works by activating chloride channels in the gut, which is going to increase intestinal fluid and motility, causing spontaneous bowel movements. It's 8 to 24 micrograms twice a day. That dose will need to be reduced in a patient with liver impairment. Some general information about lubiprostone. It can be considered for patients who are on chronic opioids, but it is known to cause mechanical GI obstruction. Side effects include headache, abdominal pain, flatulence, diarrhea, nausea, so it's actually recommended to take with food and water to help with that nausea, and it can also cause hypokalemia. The next option we have here is lubricants. Mineral oil is an example. It's going to work by coating the lining of intestines with regards to colonic absorption of fecal water, promotes easier defecation, and it's going to soften that stool. The dosing just kind of varies. There's not really like a set dose of mineral oil. General precautions: you want to avoid use in patients less than 2 years old if it's going to be given rectally, but it can be used in patients greater than 6 years old if it's given by mouth. So rectally, they need to be at least 2, but by mouth, they need to be at least 6 years old. You also want to avoid use in the elderly because of that increase of aspiration, and also with Docusate because it will be absorbed a little bit easier whenever it's given with Docusate. Some side effects include reduced absorption of fat-soluble vitamins. Next, we have guanylate cyclase C agonists. They're going to bind to luminal surface of the intestinal epithelium and increase cyclate GMP, which is going to stimulate the secretion of chloride and bicarbonate into the lumen, causing an increase in intestinal fluid, resulting in faster transit of the feces. The examples are linaclide, Linzest. It's 145 to 290 micrograms a day. And then we have penitilide, Trulase. It's 3 milligrams daily. General precautions with these medications: they need to be taken at least 30 minutes before the first meal of the day. You want to avoid in patients who are less than 6 years old, or patients who have GI obstructions or they're dehydrated. It can cause diarrhea, flatulence, headache, abdominal pain, and distension. Next, we have antidiarrheals. They are going to stimulate absorption of fluid and electrolytes, inhibit prostaglandins, which is going to reduce inflammation, motility, and also show some antimicrobial effects. An example of an antidiarrheal is bismuth salicylate, Pepto-Bismol. It's 524 milligrams every 30 to 60 minutes as needed, with a max of 8 doses a day. It also comes in a liquid form, 1,050 milligrams every 30 milliliters, which can be taken every hour, but you want to do a max of 4 doses a day. General precautions: you want to limit use to 2 days. Avoid in patients with allergies to salicylates. It can cause active bleeding, ulcers, or if they have a hemorrhagic condition, you need to be cautioned, or if it's a child recovering from a viral infection like Raynaud's syndrome, or if they're taking anticoagulants, caution use. Some side effects include black tongue or stools, salicylate toxicity, so you can see abdominal pain, drowsiness, headache, diaphoresis, lots of sweating, hearing loss, and tinnitus. Next, we have anti-motility agents. These are going to slow intestinal motility. Example is loperamide, Imodium. It's 4 milligrams once, and then 2 milligrams after each loose stool, with a max of 16 milligrams a day. Then we have Lomotil, which is a combination of diphenoxylate and atropine. It's 5 milligrams up to 4 times a day. This is a Schedule 5 medication, so it is a control. It is known to cause anticholinergic symptoms like dry mouth, tachycardia, urinary retention, and blurred vision. It can also cause TNS or respiratory depression. That's mainly why it's a Schedule 5 medication. And also seizures. General precautions with these anti-motility agents: they are known to cause torsades de pointes, cardiac arrest, and sudden death at high doses. You want to avoid use in children. For the loperamide, less than 2, you don't want to be taking it. For the Lomotil, less than 6 years old, you don't want to be taking it. Dysuria, jaundice, bacterial enterocolitis. Some side effects include abdominal pain and QT prolongation. This last set we're going to talk about here is antispasmodics. They're going to alleviate smooth muscle spasms in the GI tract, and it's also going to cause some anticholinergic effects. The only example here is dicyclomine bentanil. It's 20 milligrams 4 times a day, with a max of 160 milligrams a day. General precautions include avoid use in breastfeeding, patients less than 6 months old, or if they're greater than 65 years old. If they have a GI obstruction, they have glaucoma, acute hemorrhage, myasthenia gravis, or obstructive uropathy. Side effects include the anticholinergics, so basically like a dry mouth, dizziness, somnolence, as well as blurred vision. And those were all the medications they had listed that had an FDA approval for the use in constipation and diarrhea. Again, my name is Amber Gawana, and I wish you the absolute best of luck in all your studies.